programme in that. That review was published at the time of the World Health Assembly, and in fact that committee has had a briefing today with the mission representatives of all the WHO member states. We will continue, and that committee will continue with that review. There are currently reviews planned around the IHR Review Committee, and obviously the Director General is pulling together a systematic independent evaluation based on the WHA resolution. But we're doing internal operational reviews. We continue to review all of our performance. We review all of the language, and I'll hand over to Maria because she may be able to also tell you how we're really looking at the science and what we've learned over the last 6 months.
Thanks, Mike. Yes, so we've said this almost every time we've been up here, that we are constantly learning and we are constantly evolving our guidance to fit what is known about this virus that we didn't know about 6 months ago. I think the way that we do that is through our international networks, where we are speaking directly with frontline workers every day, whether these are clinicians and public health professionals, whether these are virologists, laboratorians who are working with specimens, with samples, looking at sequences, whether we're looking at people who are working on infection prevention and control to prevent transmission in healthcare settings, looking at epidemiology and modeling, understanding transmission and where transmission is happening, how transmission is happening, and how that affects our guidance and our advice. We are constantly looking at how we adapt our information that we share with you, and we are very careful with how we explain the situation about what we know, about what we don't know, and most importantly, how we're working with our partners to address those unknowns, because that is a constant evolution, especially with a new pathogen. I just want to mention one last thing is about what you can do yourself. The Director General mentioned this in his speech, but please feel empowered. Please know that you can do things yourself to prevent yourself from getting infected. And importantly, not only protecting yourself, but protecting your family and potentially somebody who is part of a vulnerable category, who has an underlying condition or maybe of advanced age, who will go on to develop severe disease if they are infected. So knowing what you can do, if you're in a situation where there is increasing transmission or intense transmission, if you're asked to stay home, please stay home, because there are many people who can't. And those individuals who are working in healthcare facilities, who are caring for infected patients, who are in ICU, who are in hospital beds, they can't stay home. And you, if you can, please do. We know this is difficult, and we know that people want this to be over, and there are many things that we all want to do. But it's going to be difficult for some time before we get out of this. But we will. And so not only do governments need to have strong leadership and be very clear on what needs to be done, adapting that to the most localized level as possible, you yourselves can also play a role. Men, women, children, all of you, all of us have a role to play.
Many thanks. We had a bit longer answers today, but it's because questions were good. We will take 2 more questions before concluding this press briefing. First, we will go to Chen from China Daily. Chen?